Professor Glüer, which is ECTS and which are the main scope of this organization?
Thank you. ECTS is a European organization. It stands for European Calcified Tissue Society, so obviously bone and other calcified tissues. This is what we care for, diseases in this area, research, teaching, educating physicians. These are the main tasks that we have, plus of course caring for the next generation of researchers. Osteoporosis is an important disease. There are other bone diseases, and all of these bone diseases are the theme of ECTS.
But the focus is most on research or is more dedicated on the clinical aspect of the diseases or the treatment and so on?
I would say it's 50-50 actually. We have a large group of clinicians coming here, or clinical researchers, but we also have a lot of basic bone researchers coming here, scientists and method developers. So it's really a broad mix, because we believe that only in this mix we will be able to bring new research to the patient and develop new treatments that are really helpful for the patient. So it really has to come together.
Which are the members of this organization and how many they are?
We have both individual members, but the main thing is that we are an association of European associations. So we have about 300-400 individual members, but we have, which is more important, about 30 societies from different parts of Europe, from the north to the south, everywhere. And we have also 20 further societies from all around the world. So it's really a network of societies dealing with bone disorders for the benefit of the patient.
And also from Italy?
Yes, actually we have 3 member societies from Italy. So we have SIOMS as the biggest society here in Italy, focusing on osteoporosis, but we have also AutoMed and we have the Forum. So we really have, again, a combination of different people with different focus in the area of skeletal disorders.
So you mentioned osteoporosis, and I would like to ask to you, which are the dimensions of the problem osteoporosis in Europe?
We have millions of patients in Europe, and the number is increasing. Osteoporosis increases exponentially with older age. And so with the aging population, we have more and more osteoporotic people. And the main problem are fractures, hip fractures as the most severe, vertebral fractures and other fractures. And we basically need to find ways to strengthen the bone to avoid these kind of fractures.
What about the treatment of this disease? Do you have the necessary drugs to treat the disease? Are they used properly? Which is the situation?
We have different classes of drugs. So the first class of drug that has been around for about 15-20 years now stopped bone loss. Now we have another class of drug coming to the patient. One medication already been there for quite a while, but new ones coming here that build bone. Because for a long time you don't see that the patient has lost bone, so it's not sufficient to maintain the bone, but you have to increase it. So osteoanabolic treatment is very essential, and we are very glad that new medications are coming to the market in this area. But the key problem is that osteoporosis for a long time is a silent disease which is not treated, not recognized, so we have a huge under-treatment. We have sometimes patients with 5-6 fractures who have not seen a medication. Yeah? So that's a real problem. We have good medications, but they are not always, or actually way too rarely prescribed.
And also the adherence to therapy is a problem, is correct?
When you have osteoporosis, you have to take your medication for years. And nobody likes to do this. So after 1 or 2 years, some patients may feel better and stop the treatment, and then of course the problems kick in again, yes.
And what is doing ECTS in terms of education and research for the osteoporosis problem?
Our key activity is the Congress that is currently being held here in Rome. So from Friday to Tuesday we have a wealth of different programs for clinicians, for researchers. But also during the rest of the year we have webinars in which we educate physicians or young researchers about the latest progress. And of course, we have special interest groups that meet during the year to pursue specific areas. Yes.
Very good. Let's move to rare diseases. How important they are, and what is doing ECTS for this problem?
Well, as the name implies, these are quite rare, but these are very severe genetic diseases. And fortunately, in recent years, the governments have found out that you have to be more attentive to these kind of diseases. So the possibilities to developing drugs in these areas have been facilitated. So now we have, I would really say, in part wonder drugs, where very sick children, for example, who can't walk or and live really long, they are treated and they are back on their feet and run around. So it's quite magic and very nice, of course, for research to see that their work results in a really effective new drug. Yeah.
You mentioned that the young researchers. What is doing ECTS for the next generation of researchers?
ECTS is sort of a group of opinion leaders. Also, when you come here, you basically see European opinion leaders coming here to exchange the information. So this is obviously the best setting for new researchers to learn what is important and what he or she should do in the future. So we have a very broad program. We have about 200 young researchers coming here, participating in the new investigator program. And they have a special program here. But this year is a very special year because we are founding what's called the ECTS Academy. It's a daughter organization of the ECTS, where the young researchers, the top researchers, only the top researchers from Europe will get together. Each year, only 10 individuals from Europe will be elected, and they are in this academy for 5 years. So it's very prestigious. And so for the first year now, this year, we have elected these 10. They are also Italian people who have been successful and are members of the first generation of the academy. And so we are building a home where they can really network with the other excellent researchers from Europe, because that is very crucial for success, that you don't work on your own, but you work together. And today, as we speak, we have 10 European research consortia together here, which is a very rare thing. They have gotten grants in Europe that are extremely difficult to get, very prestigious. And 10 of them come here, which I think is very unique. And they can exchange, they can network, develop new ideas. And this is what ECTS is all about, bringing people together to generate new ideas, basically, in the end, to benefit the patient, of course.